Hey folks, Dr. Joe Esposito here. I've been in practice a long time, and patients come to me all the time, and I get emails through the website, of course, drjoe.com, and people call, and they have questions. And almost daily, usually more than once daily, I'll get a question that says, can you fix this? And my answer is, I can't promise I can fix anything. I don't know if we can fix it, but this is what I would recommend you do. No promise, and I always say no promises, no guarantees. Everybody wants a guarantee. Healthcare, first of all, we can't. It's unethical for us to ever guarantee that it's going to work. So understand that we're not being evasive. We don't know if it's going to work. We do know that our track record says we have a huge success rate in this, but we can't make promises. But sometimes people call me, and I'll say, you know what, Joe, this you might want to get to the emergency room right away. No, I'm just going to wait and come see you. I had a patient a couple of years ago, and we took an x-ray on him, and we saw advanced hardening of the arteries, and he had what was called a dissecting aortic aneurysm. His aorta was blowing up like a balloon, and if it's 5.5 centimeters or more, it's a medical emergency. Do not move the patient, get an ambulance, and get him to a vascular surgeon immediately. And he was right around that number. And I said, before we treat you as a chiropractic patient, you need to get to a vascular surgeon immediately or to the emergency room. Well, I got an appointment in 3 weeks. No, you have to go now. And he's the older man. His wife was with him, and she said, honey, we need to go now. Dr. Joe said it. Dr. Joe knows his stuff. And I got a call from a vascular surgeon. It was on a Thursday. And I got a call on a Monday from the vascular surgeon. He says he was just about to die. He says, we could barely do surgery on him. He said, but I want to tell you saved his life. He says, so thank you. He would probably made it through the weekend. That's how bad this swelling was in his aorta. And so there was a case that was not a chiropractic case, was not a nutritional case. Now, he was later, but at that moment, it was an emergency. And so I'm going to talk about things that you should never ignore, because I don't want you thinking that, oh, I got this situation. I'll just wait 2 weeks and I'll make an appointment with Dr. Joe and we'll go get it fixed. Trust your gut. One of the most powerful tools you have is your own instincts. Most of us have a sense when a situation is dangerous. Now, if your instinct or intuition tells you it's serious, call 911, get to the emergency room. It's always better to err on the side of caution. I'd much rather be wrong. And I've been wrong before. I'll have a patient come in, I'll look at their x-rays or something, I'll say, listen, you need an orthopedic evaluation, a neurological evaluation before we start treating you. They go to the neurologist, the neurosurgeon, whatever. They call me up. They say, Joe, great call, but it's okay. I want you to treat him for 10, 20 visits, whatever it is. Let's see if we can solve this problem. If we can't, then we can go ahead and do more intervention, medical intervention. So I'd rather err on the side of caution and be wrong than the other way around. And I work with a lot of doctors who aren't chop happy. We had a patient come in the other day. Her spine was fused from right below her bra strap all the way down to her hips, all fused together. I can't imagine what condition this lady had that she needed 8 vertebrae fused together. And the sacrum, and ilium. So I don't know what the doctor was thinking. Now, I'm not a surgeon. I'm pretty smart, but I'm not a surgeon. But I can't imagine what this person was thinking. Now, sometimes they'll do surgery because it's a business. I mean, healthcare is a business. It's not healthcare, it's health business. And it's insurance going to pay for it? Heck, I'll fuse her up. Problem is that's dangerous because like her sacrum now can't move properly. It's not pumping cerebrospinal fluid up into her brain. And she was very curmudgeon-y. And her daughter, who was a patient of mine, said to me on the side, he says, yeah, she was real feisty after that surgery. Well, that's probably why. Because her spine is fused, she's not moving. So we work with doctors, and I trust them that if we don't need to do further intervention, we won't. They'll send them back to us. So always err on the side of caution. Trust your gut. One of the things you have to be worried about is chest pain. If it lasts more than a couple of minutes or it comes back, could be a heart attack. Now, I've had chest pain in the past. You've probably had chest pain in the past. It could be a dislocated rib. It could be a pinched nerve in the mid-back. It could be the stomach pushed up against the diaphragm, acid reflux. But if you're high probability of having a heart attack, you're overweight, you have diabetes, you're old, you're male, females have them too, err on the side of caution. I'd much rather have you do that. Don't try to drive yourself. maybe an ambulance who's equipped and trained in case you go into full cardiac arrest. They're there to help you. Now you think, well, it's expensive. I don't want to call an ambulance. I don't want the lights coming on. My father, I was back in college at the time, and I was living home. And I came home one day, and he was sitting at the kitchen table, yellow, gasping for air. And I got scared. And I helped my father up. We live in this little tiny house. Helped him upstairs, put on some clothes. My sister at the time worked with the ambulance corps. He said, I don't want the sirens. I don't want the neighbors to know. So the ambulance came without sirens, put him in the ambulance, brought him to the hospital. His lungs were full of fluid. He was supposed to have quit smoking years ago, but he wouldn't quit. And so that was the thing that scared him enough to finally make it quit. But they pumped gobs of mucus out of his lungs. That was a medical emergency. We did everything right and gave him many, many, many more years of life. So chest pain is not something you want to play around with. And he didn't want the ambulance with the lights. No, you got to go. And we did. So that was a good idea. Shortness of breath. If it happens suddenly and keeps you from everyday activities, might be a big issue. Now, you could have asthma. You could have a pinched nerve in your lower neck. That's the nerve supply into the lungs, into the bronchial tubes. Could be the stomach pushed up against the diaphragm. You're not able to get air in. Could be stress. There are times in my life when I was stressed out where my big thing is I can't breathe. I gasp for air. And I remember one time I was going through a really tough time in my life, and I went back to visit my mom. Mom. I think Dad had already passed. And she said, you realize how much you're gasping for air? And I didn't realize it. And then I went, and I was. So I was under stress. Now, it wasn't a heart attack. It wasn't a pulmonary embolism, but I was under stress. I was still functioning. Had it gotten a little bit worse, it would have been a medical emergency. So if you're just tuning in, what we're talking about today, I'm Dr. Joe Esposito. What we're talking about today are, when is it a medical emergency? When do I call 911? Not to ignore the situation. So, vision problems. If you suddenly have blurry vision, double vision, loss of vision, could be a sign of stroke or a very serious issue. You should call 911 if you have trouble seeing, especially if you have a bad headache, nausea and vomiting, numbness, weakness, confusion, trouble talking. Trouble talking is a biggie. Okay? So when we test a patient, I was trained, and I train my doctors too. If somebody's having a stroke, ask them to speak. Ask them to stick out their tongue. If their tongue goes over to one side, that's an issue. If their face droops on one side, that's an issue. If they can't speak, they slur their words, that's an issue. That's a medical emergency. It was a Sunday, a couple of years ago. It was a Friday, Saturday, and Sunday, and I started seeing flashes out of my corner of my eye, and I looked, there was nothing there. And so I was concerned. I thought it was a pretty serious issue. So I didn't think about it. It went away, and then I thought, it's just people flashing lights next to me or whatever. But it went on for a couple of days. I called my eye doctor, and it was a Sunday. I called the emergency number, and she said, come to the office immediately. And I did. And Dr. Z, she was wonderful. And she checked me out, and she goes, no, your retina is slightly detaching. She goes, it's part of the aging process. Nothing to worry about. It'll go away in a couple of days. I was glad I went. It wasn't an emergency, but it was something you definitely want to get checked out. So don't jerk around with these things. Don't think that you're tough. It's much better to be safe than sorry. So people come to me all the time with chiropractic. Of course, we're chiropractors and pain management doctors. So they'll say, well, doc, I got this shooting pain down my leg, and it's really bad, and I can't move, and I can't stand up. Okay. So the question we ask is, have you lost bowel and or bladder control? If you lose bowel and bladder control, it's a medical emergency. You need to get to a surgeon, a neurosurgeon for the spine, orthopedic surgeon for anything else right away. That's not something you want to come see us for. And I've had patients over the years come in, and they've lost bowel and bladder control. I get them in an ambulance. I get them to the hospital. Once they're stabilized, then they come back, and we work on the nervous system, the digestive system, the diet, supplements. But in that moment, it's a medical emergency. It's outside our ballpark, our wheelhouse, our scope of practice. So if you start to lose bowel and bladder control with pain, especially back pain, low back pain, get to the emergency room immediately. It's not a game, because that usually means it's a ruptured disc. And if the disc ruptures, the quicker, with anything, the quicker we can get to it, whether chiropractic or medical or surgical, or the quicker we get to it, the better off we're going to be. Inevitably. Even if it's cancer, the quicker we get to it, the better off we're going to be. So if you're losing bowel and bladder control, get to the orthopedic neurosurgeon first, then come see us. Because many times, we see patients every day post-surgical. They've had surgery, and we have to stabilize the spine, because what happens is, let's assume I have my back fused, and many of you probably have had this. If I have my 5th lumbar fused or my 4th lumbar fused, I can't move those two bones. They're locked together with metal rods and hardware. But what happens is the bones above and below it now have to move more to make up for it. And inevitably, those are the problem areas after the surgery. Now, it may take 2 years, 5 years, 10 years, but we want to stabilize them through chiropractic care. So the question I get almost every week, certainly a couple of times a week, do you treat people that have had surgery? The answer is a resounding yes. And the quicker you get to us, the better you're going to be in most cases. So we can't adjust that fused area, but we adjust above and below it. Then you'll always have an inflammatory reaction if you have hardware in your body. The body is attacking that hardware nonstop, 24 hours a day. Doesn't want it there, doesn't know what it is. It's going to create inflammation around that area. So if you've had surgery, even if there's no hardware in your body, you want to be sure you're eating an anti-inflammatory diet. And the two big foods that cause inflammation are wheat and dairy products. Wheat and dairy products cause inflammation. I had a patient come in the other day, and she had severe sinus problems, went to the Mayo Clinic, didn't know what to do for her. She came to us. She drove cross-country, actually. And I was talking about we have to adjust the nerve supply. My other doctors were actually, and we got to change your diet. And I said, no wheat, no dairy products. And she says, well, she kind of hemmed and hawed a little bit. And then we said we have to adjust the area, the nerve supply to that area. No, I just want you to clean up my sinuses. Well, you went to the Mayo Clinic. They gave you medication. You're doing sinus, over-the-counter medication. You're doing prescriptions. You've done the sprays. That's not working. Let's get to the cause of the problem. Let's open up the nerve supply to the area, and let's go ahead and get you on the proper diet. Cut out the wheat and the dairy and other inflammatory foods. So she thought we were just going to drain the sinuses for her. Well, you can't just drain the sinuses. The inflammation is there for a reason. The sinuses are inflamed. The spine is inflamed to protect you. Sometimes it goes overboard, but the whole process is a protective mechanism. And so if you keep feeding that fire, you just keep throwing gasoline into the fire, well, it's never going to get better. I don't care how many drugs you take. I don't care how many surgeries you had. So that's when we talk about nutrition. And the best foods to eat are going to be fruits, vegetables, nuts, and seeds. If it's not a fruit, vegetable, nut, or seed, it's not going to give you the best bang for your buck. So we talked earlier about meats and dairy products. If you're going to eat meat and dairy, which I wish you wouldn't, but if you do, make sure they're organic. Cut out the wheat. Cut out the dairy products. Great anti-inflammatory supplements, super greens, essential source, nitric oxide, turmeric, probiotics. Those are all on our website, drjoe.com. Omega-3 fatty acids. I take omega-3 fatty acids as part of my protocol every day. I take 2 Dr. Joe supplements a day. It's a gram, 1,000 milligrams. I want to make sure my brain is getting all the health that it can. I'm getting older. We're all getting older. But I look at people my age, and it's funny. We look at somebody, they come in, I see their age, of course, and I'm thinking, wow, you're 10, 20 years younger than me. You look horrible. What have you done to yourself? So we always try to keep the body healthy, and health also equates to looking young and feeling young. So if you'd like to come see us, if you have any health issues, neck pain, back pain, shoulder pain, digestive issues, sinus issues, acid reflux, heartburn, come see us. In most cases, we get really good results. Can't promise anything. But in most cases, people are thrilled. And the biggest complaint I get, by far, is why didn't I do this sooner? Why did I suffer for so long? And the answer is always, I don't know. I have no idea. So if you want to make an appointment in the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We can get you an appointment usually within 24 to 48 hours. We accept almost every insurance out there. If you don't have insurance, it's cheaper than paying insurance premiums, actually, coming to see us. A lot of people say, Dr. Joe, I don't need insurance anymore because I come to see you guys. Well, that's a personal choice. Whatever you decide to do is up to you. But it's so amazing, the results, in most cases, not everybody, when you get the nervous system, the digestive system, and the diet working, that you will save so much money. Most people say they can't afford not to see us because they eat better, they're eating healthier foods, they're eating less, they're taking supplements, they've cut out their coffee, their cigarettes, their alcohol because they feel better. Chiropractic is keeping them physically healthy, and they're just blown away. And they're like, Dr. Joe, I'm making more money now than I ever have in my life coming to see you guys. Not making more money, having more money, I guess I should say. So if you want to make an appointment, drjoe.com. VA, if the VA sends you here, they pay for your visit. So ask for a referral from your VA doctor. Car accidents, please come see us as soon as you possibly can. I know sometimes you can't come the next day. I get that. But the quicker you get to see us, the better off you're going to be and the less hassle you're going to get from the other person's insurance company. Even if you cause the accident, come see us. You might have insurance on called MedPay on your policy, cannot raise your rates. So your car may cover it. Your health insurance may cover it, even if it's cash, which is still the most affordable thing you'll ever do in healthcare. It's worth it. Because I held someone's hand when they died recently. And on their deathbed, I'm sure their thoughts weren't, gosh, I wish I'd saved more money. Gosh, I wish I had taken worse care of myself. No, they're thinking, gosh, I'm dying now. All that is not important. Had I taken better care of myself, I may not be in this position. And I want you to think about that. Is it worth it not being healthy? Absolutely not. So if you want to make an appointment, drjoe.com. We'd love that opportunity to see if you might be a patient that we might be able to help. drjoe.com. Book it right online or call us. Other things that you want to get to the emergency room right away for. Minor burns, no big deal. Redness, swelling, not a big deal. Get to the emergency room if a large part of your body or the burn is on your feet, your face, your buttocks, your groin, or big joints like your knees or your elbows. Also, get medical attention if you have blisters, blotchy skin like a second-degree burn, or if it's bigger than 3 inches or it becomes charred and white, third-degree burns. You know how you know a burn is really bad? It doesn't hurt. How could that be? If it doesn't hurt, that means you've burned the nerves and you're incapable of feeling the pain. That's a serious burn. Get to the emergency room immediately. Because it's not just the burn you have a problem with, you run the risk of infection. Your skin is this big coating, this giant protective mechanism that keeps the bad stuff out. And so if the burn is there, the bad stuff can get in. And that's where it becomes a real serious concern. Don't jerk around with that. If you start vomiting up blood, if you vomit up something that looks like coffee grinds, that's a very serious situation. You need to get to the emergency room right away. If you have other symptoms, severe headache, abdominal pain, confusion, trouble breathing, heart rate issues, and you're vomiting, get to the emergency room. Children younger than 6 should be seen right away if vomiting lasts for more than a few hours, because that could lead to dehydration. Little story for you. It's a woman, pregnant, severe morning sickness. Couldn't even put ice in her mouth. I thought we were going to lose her. So I'm racing my mind. How do we get fluid into this person? And she can't put anything in her body. Put her in a bathtub. In the bathtub, your skin is a sponge. It starts absorbing fluid. Friend of mine has cancer. Doesn't want to eat anything. Doesn't want to drink anything. I said, at least sit in a bathtub. Absorb fluid through your skin. So when you take a bath, that's why I like a whole house water filter. I use a company called Pure Life Water GA. PureLifeWaterGA.com. It's on the website, actually. If you go to clinics, you'll see a link to their website. I have a whole house water filter from them because if I take a bath, if I take a shower, if I drink water, if I wash my fruits and vegetables, I want the water to be pure. I don't want chlorine, fluorine, bromine, chemicals, leftover medications, because the filtering system we have can filter out viruses, germs, bacteria, fecal matter, urine, but they don't have filters to filter out medication. So if somebody pees and they're on birth control pills or cholesterol meds or whatever, well, the water's going to get recycled and the pee is going to come out, but the medications can be left in there. Now, again, it's very small doses, but why have that if you don't have to? So I filter out every drop of water in my house, and then if I'm going to take a bath, the water's going to be absorbed through my skin, and I want pure water being absorbed. So I recommend that. They're not cheap, couple of $1,000s, but boy, is it worth it. I've had people comment on the water in my house. The water tastes so good here. It doesn't taste good. It tastes like nothing. Oh, yeah, that's what it is. I hate that chlorine taste. If you go to a restaurant or something, it's chlorine tasting. So if you're vomiting and you can't absorb water for whatever reason, including morning sickness, getting in the bath is a good idea. Again, if the vomiting lasts for more than a few hours, if it's bloody, if it looks like coffee grinds, that's an emergency case right away. I'm board certified in a lot of things. I'm board certified in chiropractic, orthopedics, pain management, double board certified in nutrition. I'm also certified in traumatic brain injuries. So I deal with a lot of traumatic brain injuries, car accidents. Other doctors will send their cases to us because they know I'm certified in orthopedics and pain management and nutrition. If you hit your head and you lose consciousness, that's a traumatic brain injury. If you get confused, that's traumatic brain injury. But here's the thing. You can remain conscious and still have traumatic brain injury. Because what happens is, even in football, helmet protects the outside, nothing protects the inside. So if you get hit, your head will snap forward and backward, let's say a car accident. The brain is going to slam into the skull and be bruised. That's a traumatic brain injury. Severe cases could be paralysis, loss of speech, non-responsive, coma. But even mild traumatic brain injuries, those become serious problems long-term. So we have a nutrition protocol we've put together for traumatic brain injury patients, and it's pretty much the same protocol that I've recommended to all of you. Cut out the 7 deadly sins: alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener. More raw foods, fruits and vegetables, nuts and seeds. Super greens, essential source, nitric oxide, B complex, turmeric. Turmeric's anti-inflammatory. So when I see traumatic brain injuries, we always have to look at how do we get the inflammation down and how do we get the brain rebooted. And then there's even exercises we can give you. Chiropractic is great for stimulating the brain. Adjusting you sends a barrage of neurological impulse up into the brain. Sometimes we adjust one side of the body only, depending where the traumatic brain injury is. So we're really good at traumatic brain injury cases. We've had a lot of people in wheelchairs come see us. Again, sometimes at least we get them healthier. We may not get them, running marathons, but at least we try to get them as healthy as possible. If you see a deep cut, if you see fatty tissue underneath the first layer of skin, get to the emergency room. You'll need quick attention. If you don't, it can close up. If you have a cut around your face, your genitals, across a joint, get there right away. Not long ago, I did real bad damage to my index finger. I was trying to move a rock out of my garden, and I was using a pick, and it slipped, and I sliced the top of my skin, top of my finger, and you could see the bone underneath it, and I can see the fat. Yeah, I went to a medical emergency. I walked in. I did not put peroxide on it. Please do not put peroxide on it. It destroys the healthy skin. Washed it off, got to a walk-in clinic. Doctor looked at it. She goes, no, it's fine. She goes, it's going to heal nicely. It's a smooth, clean cut. We can stitch it or not. I said, well, if we don't have to stitch it, let's not. She said, okay. And she cleaned it out for me. And she said, just monitor it, wrap it, and you were fine. And it healed. And I still feel a little bit of tightness in the finger. Not a lot. It's getting better as time goes on because I've been adjusting it and keeping it healthy. But that was definitely a medical emergency. That wasn't a chiropractic emergency. That was a medical emergency. A lot of times people come to us with digestive issues, stomach pain. If it happens suddenly and intensely, could be a medical emergency. If you have pain in your right lower abdomen, that could be the appendix, especially with a fever. That's an emergency. Men, if you have testicular pain or swelling, that's a medical emergency. So there's a lot of things that are medical emergencies that we may not be able to treat initially, but we want to treat you long-term so the body can heal. So if you have a health issue, not one of the ones we talked about, neck pain, back pain, shoulder pain, headaches, numbness, tingling, car accidents, sports injuries, come see us. The quicker we get to you, in most cases, the better results we're going to get. Normally, the first visit is $720, and half the second visit, we reduced that to $299. We're going to keep that going because it's pretty popular. Exam, x-rays, consultation, first adjustment, going over the x-rays, and a complete nutrition evaluation. We accept almost every insurance: car accidents, sports injuries, Medicare, VA patients are referred to us all the time. Ask the VA doctor to send it to it. If you have any questions, send it through me to the website, drjoe.com, and do me this favor. Follow us on social media at Dr. Joe Esposito. Again, the website, drjoe.com.